Hello. In this video, let us look at this gynecology textbook, Shaw's textbook of gynecology, 18th edition. Let's look inside also. So just one glance inside first. Now let us look at the content in this textbook. You have section 1, anatomy, physiology, and then disorders of menstruation, common gynecological conditions, benign conditions, infections, urinary and intestinal tract, malignancies, carcinoma of cervix, ovarian tumors, cancer of body of uterus, all vulval vaginal cancers, etc. Gestational trophoblastic diseases. And then coming to radiology type of section, imaging modalities, endoscopic procedures, major and minor operations in gynecology. Sounds like a good content. And here they are saying that there is a list of videos and PPTs. Where will we get them? Was there some CD attached with this? What is? Let's go to one particular chapter and look at the entire chapter. I think gynecological approach to patients should be history taking. Yeah. So you have a history taking performer here. Present illness, past and personal history. So if you hold this book, you can take the history from the patient. So looks like this pro forma you can keep, and for each part you can read from here and ask all those questions to the patient and get the history. And physical examination, general examination, systemic examination, and then the abdominal examination. I wish there were some images here as to how to examine. Palpation, percussion, auscultation, followed by the gynecological examination, for which they are using the Cusco speculum they are showing here. But maybe you will need permission before putting this from your seniors especially, and you may not be allowed to do this for certain patients. Please do check. Now let's move on. So at the end of every chapter, they have given the key points, okay, what they covered in this chapter, which I think is very useful for you. You can revise at the end of the, or you can read this first and go back to the chapter and see what they are trying to explain in this, right? And then there is a self-assessment that these questions they can ask in the exam and you can learn answers for them. They didn't give any MCQ. They could have given 2-3 MCQs, I feel. Okay. Development of, this is embryology, development of female reproductive organs and related disorders. Images in this that we cannot show, so you will have to look at the book, guys, because this is having a lot of genital images. And what is this? Instruments they are showing, so you can learn all the instruments here. How do you differentiate a forceps? See, forceps, and these two are scissors. How can you differentiate? Forceps has this kind of a lock between these two, but scissors doesn't have. Another thing is these two cross each other so that it can cut as a scissors, but these two do not have that crossing behavior. They don't cross each other, so they don't actually cut. Okay. So first thing you have to identify is whether it's a forceps or a scissor. And then this one is Babcock forceps. This is important. Alley's forceps. It's a little sharp. Artery forceps. This you will see in all, right? This is some hysterectomy clamp they are saying. This is also like a forceps only. You'll have to just check the exact use of these instruments, guys. What is this? Instruments needed for diagnostic laparoscopy. Okay. Lot of other information given here which you can go through. So that's all, guys. In this video, we have covered this textbook, Shaw's textbook of gynecology. Hope you have learned something. Bye-bye.